Okay, so we're going to talk about vaccines that you'll be giving to dogs and cats in small animal practice. And we're going to talk about core and non-core vaccines. So the first core vaccine for canine is rabies. It is required by all states that the animals are that dogs are vaccinated for rabies. It is not required by all states or counties that cats are, but for dogs, all dogs are required to have rabies vaccines. And usually we give the first dose of rabies at 12 weeks. Then we booster with the second shot 1 year later, and then depending on the state regulations, it's boosted every 1 to 3 years. It also depends on the type of vaccine that the doctor uses. If the company guarantees that it is good for 3 years, then they can use it for 3 years. Rabies for canines tends to be killed, and it is considered a monovalent vaccine, which means there's only one virus that is in that vaccine. You never want to mix vaccines together. So just because you are giving rabies and you're giving distemper doesn't mean you can use the rabies vaccine to reconstitute the distemper vaccine. You always want to use them in individual syringes. The second core vaccine for dogs is DHPP. This is the distemper, hepatitis, parainfluenza, parvovirus, plus or minus corona or leptospirosis. Kind of depends on whether it's a puppy. Puppies tend to get corona. Leptospirosia depends on the area that you're in. It is starting to become more common. These are given with as puppies, usually at I would say 6, 9, 12 weeks, with the third one being when they get the rabies vaccine. And some dogs, especially black and brown dogs, they get a fourth one to overcome their mother's immunity that they've gotten from the colostrum. This is also a modified live, and this is considered a polyvalent vaccine. So some non-core canine vaccines, and basically what a non-core vaccine means is it's a vaccine that is, if a client chooses to, or if the veterinarian in his vaccine protocol has standards for it. If a dog is going to be boarded, probably Bordetella, which is also called kennel cough, is a good idea. Not all dogs may need Bordetella. Lyme, this is a sub-Q vaccine for the prevention of Lyme disease. Some dogs may need it, other dogs don't. You know, in Nevada, we don't see a lot of ticks, especially if you stay in the city, so not every dog needs Lyme. Giardia, this is a sub-Q vaccine. It doesn't prevent Giardia, it just prevents the shedding of the oocyst. And then there's canine herpes virus, not seen very often, though sometimes you may see it in a few cases. Again, this depends on the risk that the animal has. So, core feline vaccines, again, rabies. Though not every county or state requires cats to have rabies vaccines, they should have a rabies vaccine. If they don't get vaccinated for rabies, they bite someone, chances are that they'll have to be euthanized and then decapitated and their head sent off for a rabies scan. So we want to encourage our clients to do rabies vaccines even in cats. First dose is given at 12 weeks. The second is given 1 year later. And whether it's boosted every 1 to 3 years depends on the state regulations, the veterinarian's choice of protocol, and that mainly has to do with the type of vaccine that they've chosen and that the manufacturer guarantees. There are 2 different types of feline rabies vaccines available. There's killed or modified live, and it just depends on the type that the veterinarian chooses to pick. The other core vaccine that we see in felines is FVRCP. The RCP can be mixed in different orders. Basically, what it means, FV means feline virus. So these are all feline viruses here: rhinotracheitis, calicivirus, panleukopenia. These are an initial series of 3 every 2 to 3 weeks, usually with the third one corresponding with the 12-week rabies shot. And then they can be boosted every year. Again, depends on the veterinarian and the protocol that they have. These are modified live, and again, this is a polyvalent vaccine. So some non-core FELV, feline leukemia virus vaccine. This is a vaccine that is based on whether the animal is exposed to other cats, is an indoor-outdoor cat. You want to make sure that you always give the feline leukemia vaccine in the left leg as distally as possible. This vaccine has been known to cause fibrosarcoma. It's easier to amputate a leg than it is to amputate a shoulder. So it always goes in the left hind leg. FIP, they're not quite sure if this works or not, so plus or minus. FIV, again, the jury's out on this one. The chances of this working are about 50%, so it's very slim. Giardia, again, it just stops the spreading of the cysts. Dermaphrodite, ringworm vaccine. This is a great vaccine that's come out, helps a lot in shelters or areas that keep lots of resident cats in one group, and it's to prevent ringworm.